Director of Accountability. I'm glad to be joining you today. The commissioner is unable to join us today due to a family matter, and he sends his regards. And so we have a jam-packed day and afternoon for us here in this quick hour. You can see we're going to have some quick remarks from the governor coming up. We'll be speaking a little bit about and extending and expanding upon what the commissioner spoke about during his press conference this morning with the governor. We have a great panel of local health department experts on with us, and we're excited to hear from them. Quick update from our ESU partners about the face coverings. And then we have just a couple of quick highlights from NDE as far as Launch Nebraska. So I'm glad to join you and want to just reiterate a few of the guiding principles that the commissioner spoke about today, specifically two that I just absolutely want to underline. The first is safety first. That's why we've been relying upon our local health department partners and experts from DHHS, UNMC, all of our partners in the public health space to leverage science, data, and the public health leadership to help us make the really tough choices that we have right now and that we know that you all are making. We also are really pushing this idea of being equitable and centering what is best for our students, our families, our teachers, and especially those that have been disproportionately impacted. So I wanted to just underline and highlight those two. You're going to see those throughout our presentation and in a lot of our Launch Nebraska materials, but just wanted to kind of provide that little bit of context right there before we move into some of our updates. So again, thank you for joining. Glad to have you and glad to have this day to speak about our relaunching into the school year. So I'm not sure whether we have the governor quite yet. Is the governor on? We may not have the governor yet. So we'll go ahead and just keep going to the process, and then we'll come back. If somebody who is on with me could watch for when the governor joins, then we'll jump back to him. I'm going to turn it over to Zainab Rita, Dr. Zainab Rita, who's really been leading the conditions for learning space for us. And Zainab is going to walk through a little bit about our kind of leveled guidance, the graphic on the right, but more importantly, the process on the left and really what this looks like. Go ahead, Zainab, thanks.
Thank you, Lane. Good afternoon, everyone, and thank you for joining us today. What I would like to provide a quick review around the Return to School Health Guide. NDE is really committed to providing a high level of information regarding COVID-19 and as it pertains to the health and safety of our students and staff in our schools. We are working collaboratively with the Governor's Office, Department of Health and Human Services, local health departments, and a university, including UNMC and other state agency on COVID-19. As this graphic shows, return to school plan is part of the continuum of school decision making. Really involved of essential action designed to motivate thinking, planning, and prioritization. So the process starts with the first step of conducting a risk analysis, which is from the local health department standpoint, school will be able to open depends on the risk analysis. Whether we have minimal spread, in this case green, minimal to moderate, yellow, or orange, moderate, and finally red, and when if there's significant transmission. So we have provided different scenarios based on each level, whether it's green, yellow, orange, and red. I really encourage you to explore Launch Nebraska and review that guide. We encourage schools to work with local health department to understand what the community risk is, and it's important for the what is going on in that community, and understand whether the risk is as significant or not. In addition to the risk analysis, it's very important to review the phases that the governor used statewide, whether the community is in phase 1, 2, or 3, and then try to merge two of these concepts together, so to help you communicate and also understand how much spread is happening in your community. The second step is basically to identify and tailor protocols that your school should put in place based on the risk analysis. The third step is planning, working with your staff, with parents, with the students, and even with the committee if you have a pandemic response committee. So you develop your plan and understand assess your school building. We understand that there is no one size fit all the approach in one plan. So we need to make sure that we differentiate strategies based on school levels and students' needs. The last step is really to review your plan and communicate. Work with your local health department in order to review your plan and push your thinking. Again, our health guide really provides a series of recommendations for how school can approach the 2020-2021 school year and really offers adaptable consideration to meet each community unique need. Before I turn it over to our health department panelists, I would like to offer some clarification on the role and responsibilities of our partners who's been involved in safely reopening schools, and he mentioned it today at the governor's press conference. When it comes to the local health department, and I know have Susan from NALED is going to explain a little bit about what are their role, but it's really, they help to consult with the superintendents and provide guidance and technical assistance to local schools and try to develop or even continue open communication with district and ESUs within local health department region. Also, local health department determine consistent protocol for when cases occur within schools. They regularly communicate local about COVID-19 status, including risk dial. As far as local school district, the role and responsibility to consult with local health department, and as I mentioned it earlier, how tailor their protocols and plan around plan safe return to school document, create process of regularly consult with local health department and working on the analysis risk, and communicate plan with the community stakeholders. Department of Health and Human Services, their role and responsibility basically monitor public health data. They establish DHM requirements in consultation also with local health department. And also in collaboration with local health department, DHHS help to develop or adjust response plan as the situation changes. NDE, we ensure education leaders follow protocols and safety measures as instructed by local health department, public health, and NDE is really committed to provide technical assistance and differentiated support for schools. Finally, UNFC and other consultant partners, really their role and responsibility to share updated research with statewide healthcare community, including Department of Health and Human Services and local health departments. They share update research within states wide healthcare. Now, I would like to turn it over to Susan Bakra. She's the Executive Director of Nebraska Association Local Health Director. Susan, thank you for joining us today, and truly thank you for all the great work that your association has been providing during COVID-19. Would you please highlight the core principles of local health department in working with the schools? And what are your approaches?
Thank you, Zainab. Could you hear me okay?
Yes.
Okay, great. Thank you. I'm just going to kick off a little bit before the health directors who are on the call with me are able to provide some more details, elaborate more, and answer questions that folks might have. But there are a number of principles that the health directors really think about when they're working with schools through the COVID-19 and any outbreak. And they're all really based on science and also being locally responsive. So they're monitoring and evaluating the public health data at the state level as well as at the local level. Our health departments are really interested in seeing schools stay open because we recognize the unique nature of schools and how important of a role school plays for children and adults and the health and well-being of whole communities. They are working closely with all of you who are on the call to develop plans that work best for your buildings and for your districts. Some of their recommendations in that planning is really center around the idea of asking students and staff to wear cloth face coverings, maintaining general physical distance when that's reasonable, and frequent hand washing and other sanitizing. And then they're all working together to think about different scenarios and be responsive to when there are positive cases confirmed in schools, and what they find when they're doing those case investigations is really going to be what determines the number of close contacts there are in a school building, as well as the number of the number of folks in the building that are going to need to isolate and quarantine. And looping back to Zainab's description of the role of local health departments, that is another key role. It is their role to decide, to determine through case investigation who needs to be quarantined and isolated, and ultimately excluded from schools. And so that is some of the core principles. But again, I will just re-emphasize that they're looking at the science. They are looking at the advice of various experts in our state and nationally, and they're also working with you all to figure out what the specifics are in your buildings and in your districts. And so I know that there are a number of health departments that are on now. Michelle and Jeremy and Kim. Do you have any, what would you like to add?
Sorry, Susan, before we get there, I do want to acknowledge that the governor has joined the call. So if it's okay with everybody, if we can just skip back, Zainab, to the governor. I do want to make sure we get the governor's voice in here while we have him. So Governor.
Oh,
thanks for joining.
Well, hey, that's fine, thanks. But you've got me for the full hour. So if you want to go to the public health directors, I can pick up after that just to kind of continue the continuity. Does that work okay?
That works great. You bet. Thanks. Thanks for joining.
My pleasure.
I'm going to loop back and ask Michelle or Jeremy or Kim, what do you have to add? And are there any questions, Lane, from the group?
So far, not seeing any questions. I think one that keeps coming up and would love to hear, I think this is getting to it on this slide here, but would love to hear just some standard response, some discussion in general around when a case is positive, when a student or a faculty member, staff member is positive in a school. What kind of goes into that decision making? What is going to be your process, and what do you need from our school leaders?
Michelle, you started. I'll let you take that one.
Okay. I wasn't going to talk about that right away, but that's okay. I'll go ahead. Thank you. I'm Michelle Beaver. I'm the director at South Heartland District Health Department. We have Adams, Clay, Nuckolls, and Webster counties, and ESU 9. And we're doing a lot of work with our schools and meeting weekly with ESU 9. And we've helping people look at plans from so many different sources. And answer a lot of questions. And that is one of the questions, Lane, related to what happens if there's positive folks, and what happens with them, and what goes into that discussion and decision. And so the health departments, we do a case and contact investigation both. So when there's a positive case, we have a process where we communicate with that case right away and try to figure out first where they might have been exposed themselves, but then also where they've been since they developed symptoms and a couple of days before that, so we can figure out who else might be exposed. So who are those close contacts? And that's the contact tracing or contact investigation. And we look at a number of different things in that process. So we're looking at whether what sort of the context too, like what's our community spread, but also was that individual who tested positive wearing a mask most of the time? Were there other students and staff who were within 6 feet of that individual with COVID-19 for more than 15 minutes? And were they masked? Was that individual part of a cohort within the building, or did they interact with a large number of students and staff throughout the day? And what are the other kinds of cleaning and disinfecting and other sorts of prevention mechanisms that were in place in those settings? So we look at the context, and I think we appreciate it. May be harder sometimes for others to appreciate it, but we appreciate having the opportunity to look at the individual context so that we can choose just those close contacts and not more folks, and it'll reduce the number of folks that need to be in quarantine to protect others. So we go through that process, and we'll make those decisions with assistance from the schools. And this is where you can be really helpful to us as we get to those points in documentation of seating assignments, and whether that's in a class or on a bus or in the lunchroom. If we can have documentation of who was where when, that really moves things along for what those close contacts might be. And I see that the schools are likely going to be very important for us in our communication to the community and the parents and staff. So to help us get information out, it'll be critical for us to have really good bidirectional communication processes in place. And those are some of the things that we're working on, sort of unfortunately or fortunately now, as we have some examples that are occurring with activities that are happening before school starts, where we have some exposures in some cases. It's allowing us, or affording us the opportunity to sort of work through some of these protocols and fill in what some of our major barriers and gaps are to that. So I'll stop there. Others probably have more and better things to say.
Thank you, Dr. Beaver. Sorry, my audio didn't work, but I wanted just to acknowledge, to thank all the local health department who joined us today. Truly, thank you for all the great effort in reopening schools. And what I would like to ask briefly from, first, let me introduce Michelle, Dr. Beaver from South Heartland. We have Myra Stoney from Southwest Nebraska Public Health Department, Jeremy Ishelman from Two River Public Health, Kim Showalter from Public Health Solution, Kim Engel from Panhandle Public Health, and Teresa Anderson from Central District Health Department. Thank you all for joining us today. Quick review, can you highlight some of the collaboration effort between local health department and school in regard to return back to schools? I'm gonna have one of you volunteer and go first.
This is Kim Showalter. I'm glad to jump in. Can you hear me?
Yes.
Okay, I'm having a little audio trouble, so let me know. I would just say that I feel like local health directors are really kind of the best eyes on the ground for the school district. So more than anyone, we probably know what's going on in the district. We probably know what the transmission levels are, where there's cluster outbreaks, where there's big concerns, where there's not so much concern in our district. So I think the collaboration between schools and the local health department is important. I know for my district, and I think others, we have done a really good job of working. The superintendents have done a great job of working with us, meeting with us regularly to kind of pick our brains and say, okay, what's going on and what are the best practices? I know sometimes it gets a little frustrating, and it gets frustrating for us sometimes too, because the CDC guidelines will change a little as we learn more about this virus, and that's just kind of the nature of a pandemic, and that's that's kind of what happens when we're learning as we go about a virus. But I do think it's important to take all of the tools that the local health director has, work with the superintendents. We have worked with school nurses. What we always say is the important thing is to kind of, as you're developing those plans, use all the tools that we can give you and all the information that we can give you, but then it's your decision, you know, to make at a local level. The risk dials is one piece of that decision. We try to work with nurses and kind of teach them how we do contact tracing. So as you're looking at those environments in schools, you can kind of think like a contact tracer and say, if we had a positive staff member or child in this area, what would that look like? And sometimes I think we all get a little, I think I get a lot of questions on, okay, here's 12 scenarios. What would happen in these scenarios? You know, do all the kids go home to quarantine? Is it one kid? Is it two kids? How many would it take? And I think those are questions, I'm going to reiterate what Michelle said. You probably don't want us to answer those, you know, just in black and white without any more information, because we're going to try as best we can to keep kids in school. So as we think like contact tracers and contact investigators and go into each one of those situations, the environment is going to dictate what happens from there. So I just want to say that I think my experience has been that the superintendents do a great job of just maintaining open communication with us. We get a lot of questions, we answer a lot of questions, we have to find out answers to a lot of questions, but I think we're all in this together, and I think the collaboration is positive for all of us.
Thank you, Kim. That's great. Lynn, are there any questions? If there are no more questions, I do have.
There are a couple. Yeah,
Okay.
Zainab, and your audio is much better, so thanks for switching over to your
Sure.
phone. Jeremy, I see that you answered a couple of questions. I'm wondering if you would kind of take a stab at answering all three of those questions in one kind of statement. Would you be willing to do that for us, Jeremy, please?
Yeah, absolutely, Lane. Thank you very much. Jeremy Eshelman, Two Rivers Public Health Department, and just in total consensus with what Dr. Beaver and Kim are saying in regards to all the work that's been done by our schools. So many of the questions I was looking at in the chat box were around masks, specifically face masks for individuals. And you have to keep in the thought process as we're talking about face masks. It's a very effective risk mitigation strategy. It's not perfect by any means, but if we look at risk mitigation, you know, our best risk mitigation is social distancing, 6 feet or more. Secondary risk mitigation is face coverings, coupled with hand washing, the other non-pharmaceutical interventions that we talk about all the time, you know, staying home when sick, et cetera. When you apply all those aerially, that's really our best protection overall. And I think one of the questions was in regards to, should we require face masks for students? It really comes down to a decision that needs to be made by the school district in consensus with the local public health department and their community of what's best for them. I know we're having a discussion, it's very prevalent across our 7-county area right now. Personally, I'm a big fan of it. I think if you go into a school setting and you aren't using face coverings and masks, you know, you're not using all the tools at hand to really avoid increased prevalence. But that's my personal opinion. I don't want to speak for all other local health departments in any way, shape, or form. So I think there's a question about the CDC guidance about the 10 days after the beginning of being symptomatic. You know, the challenging part that we've seen, and as this has transpired, it's a new disease. We're getting better information all the time on this. There are individuals that continue to shed virus. We saw this with some of the very first individuals in the biocontainment unit. They can shed it for well beyond a couple months. That being said, we believe the most infectious period is typically 48 hours before symptomatic period begins. And most of our case investigation data leads us to believe that there usually is a key indicator in our individuals that are symptomatic. You know, in some of our younger populations, we're seeing things like rashes, diarrhea, things like that. The iconic symptoms that we've talked about for so long, shortness of breath, cough, fever, are very endemic in our population, becomes severely sick and ultimately becomes hospitalized. It tends to be an older demographic. But as we all know, in our data, it really plays out at this point in time, is our younger population has a much higher asymptomatic rate in a lot of ways. But nonetheless, in regards to, I know we talked with one of our local ESUs about this today, but as far as the quarantine period for close contacts, it really is that 14-day period. It's so important to adhere to that because we've seen many cases where somebody would convert on day 13 or at the very end of their quarantine period. And we've had people that just so important to get the message out that the test is really just a spot in time. And it really is not a good practice, nor do we condone testing out of a quarantine period. That's a well-established period that we know that's an incubation period that somebody can convert at any point in time just because you have been exposed. You're in a quarantine period, you test out 1, 2, or 3 times. By no means does it indicate that you're no longer at risk of developing it at some point in time. Quite the opposite is true, is that 14-day period really needs to be maintained. So that being said, I think the comment was about 24 days to allow school, you know, if someone's sick and close contacts and things of that nature. I mean, that math plays out quite accurately, unfortunately. That's really kind of what we're looking at in some ways. Now, one thing to note, and this is just in our little small area of the world in Two Rivers, we've seen just in the last couple of weeks, you know, the vast majority of our population that's testing positive is in that age category of, you know, about 19 to about 39. And so just so important for us as we're trying to get messaging out to the general public, you know, to make sure we're wearing masks, make sure that we're trying to social distance, things of that nature. So.
Thank you, Jeremy. I have a couple of questions. So one for Myra, if it's possible, or Teresa, could you please identify some actions and point of consideration for school administrators in general as we are opening the schools? Teresa, Kim, Myra.
Dana, can you repeat the question, please?
Absolutely. Can you identify some actions and point of consideration for school administrators?
Well, I think every one of our school administrators are doing the actions and considering all of the things that they should be. I know in addition to the weekly meetings we have numerous phone calls and we're reviewing plans. So just like us, they're trying to find answers and do the best they can for their communities. I think nearly all of them now have their plans out or are making them public. Many were last week. This coming week, there's more. And I would say just remain nimble and be ready to change as information changes and more evidence comes out one way or the other. I wish we could say this is how it is and this is how it will stay, but we're going to learn more and more about this virus as time goes on. So,
thank you, Kim. One more question. I want to make sure that since Teresa and Myra are here, we can acknowledge their attendance. What type of technical assistance local health department can offer to schools? I know Jeremy mentioned some, and Michelle and Kim. Could you identify, you know, other technical assistance that local health department can help the schools especially during the pandemic?
Oh, I'm waiting for Myra to take that. But I will just tell you, as far as technical assistance, what we would like to be able to provide is regular updates on the number of cases. And we're working to be very responsive to how the school districts would like to see that information given to them. So I think the communication right now in establishing the helpline, I guess I want to say, between the schools and the health department, and making sure that we have hopefully a plan for each of our school districts just to keep on file, so that when you start calling us and asking us questions, we can easily flip to the pages of your plan determine where at what level or what stage you're at, and then respond appropriately. So I think the technical assistance right now is just us all getting on the same page and making sure that we're speaking along the same lines, and that we're not using public health jargon, which is less than helpful many times. And then also, again, being able to provide the data for you that you need in order to make decisions, and then the additional public health insight. But I agree with Kim, the schools are doing a fantastic job now of preparing for all different types of scenarios. And it's unfortunate that we're in the middle of a pandemic, but we can't escape it. So we have to almost embrace it. And I think that's, as we move forward, that's probably our key message is let's all work together through this and do the best we can to keep our staff and our students safe while they're in the school.
Thank you, Teresa. Our last question, I don't know if Susan or any of the public health director can help us to clarify the risk dials. Can you explain a little bit about, at least a couple of, the risk dial like that you developed, under your district?
Who wants to take that?
I can start, or go ahead, Jeremy.
Oh, okay. We can work this together, Michelle, if that's okay. So I think the intention of the community risk dial was really try to provide the overarching indication of where any community is at any given time to some extent. Some of the factors that go into that are many of the metrics and data we see all the time in local public health. We talk very much publicly about positivity rates, we talk about total number of cases, things like that, but there's many things also behind the scenes that we really, with the formation of this, we're trying to assess, like, how do we get this message out to the public, the things that we see in local public health all the time that are concerns. And so one of the areas, like for us at Two Rivers, is testing and testing availability. We know how important it is to effectively provide quarantine and isolation of individuals is first the identification of positive individuals. And so testing availability is a key factor, for us. And that's been one of the areas we've been working on well for 45, 60 days or so. And we've seen these ebb and flows, as far as testing reagents, testing supplies, private testing versus National Guard or Testing Nebraska functionality. And so those are things that we've been continuing to work upon to make it convenient, accessible to our population. So that's something that it's just well established. We know that there has to be a fundamental capacity of work we do in order to limit and slow the spread of this. So that's a significant factor. I mentioned already positivity rates, hospital metrics are included in there, personal protective equipment is included in there. Those are all factors that take into consideration. I'll pick on personal protective equipment. Why is that a factor? Well, some of our high-risk individuals working every day in the front lines, whether they're in long-term care facilities, hospitals, you name it, if they do not have the ability to protect themselves, that creates a major concern for us, because as we know, then our hospital system becomes overwhelmed very quickly. So in addition to hospital metrics, obviously, that goes without saying, that's included in there. But those are just a few things off the top of my mind right away. And Michelle, I'll let you definitely add on to that.
Just will add that we look at the context of the community as well and have some things that are a little bit more subjective, but we pay attention to, for example, how well the directed health measures are being followed in our districts, and whether there are plans in place and people are submitting those when they're supposed to, and whether they're following the plans, and whether people are social distancing, and if there are mask requirements places, if people are following those. So we kind of look at that context as well, to say we can capture certain things with metrics, but we also know that there's a context around things that it's a little harder to capture. So we include a little bit of that more subjective data in our decisions. So Jeremy's right. We're looking at all of these indicators that kind of are important for us, but we're trying to make them visible and understandable to you, so you can use them in making your decisions.
Oh, and if I can add one thing, and Kim Showalter said this morning, we've said it 100 times within our district, it's the risk dial is one tool in the toolkit, and there's a lot more decision making that goes on in addition to just looking at where the risk dial is. It's a useful piece for us, but it's not the end all be all, and we need to remember that.
Thank you all so much for that and for answering these tough questions. We're really lucky for your partnership, really lucky to have you in our state, spread out across our state. Governor, I do want to give you an opportunity to chime in here if there was anything that you heard that you wanted to share out. I know you had a press conference this morning, maybe share a little summary of that, or we'll just give the floor to you if that's okay.
Yeah, great. Thank you very much. Appreciate it. And first of all, I'd like to thank all of our public health directors. We've been working closely with them at the state level since the beginning of this pandemic. And so really just want to emphasize that all the things they're talking about and why it's so important to stay in good communication between superintendents and public health directors, getting the best information, and then ultimately making a decision that's going to be right for your school. That's what it's about. The question about masks, for example. I think that gets back to our rules that we've been talking about for 4 months. If you're going to, at the end of the day, this is a virus and it gets spread from one person to another person. So if you've got a classroom where you've got kids that are going to be closer than 6 feet, yeah, they ought to be wearing a mask. I mean, that's one of the tools that will help mitigate that. If you're going to have kids farther than 6 feet apart, well, then maybe you've got more discretion about whether they have to be in masks. And then, of course, the logistics of how you actually manage that is going to be something that you're all going to have to work on, within your individual districts and even building by building. But your public health directors can be of great help in, helping you understand what is going on within your communities and giving you the most up-to-date information. And as they said, it's a pandemic. We're all learning through this together. And so sometimes the information does change. And so that's another great reason to stay close to your public health directors. So, today what we're talking about is just had the commissioner talking about some of the plans for rolling out schools. And this is where, again, having a plan for how you're going to handle this. The commissioner went over Dr. Grover's plan, which we heard on this call a couple of weeks ago. That is a very thoughtful plan that gives parents options of doing remote learning or in classroom learning or a hybrid of both. It talks about masks, it talks about cohorts, it talks about testing, talks about hand washing. I mean, all the things that you want to have in your plan to be able to do it, to be able to make sure you're keeping people safe is right. So I think that's really important. One of the things that we talked about today that I also want to emphasize is what Dr. Robert Redfield said last week. He is at the CDC, and his message was having kids back in classrooms is a public health issue. That, for all the reasons you all know about academic progression, about physical health, about mental health, about socialization, about nutrition, all the things that schools provide are all really important reasons to have kids in classrooms. And one of the things that he was talking about, and of course this is national data, so it's not Nebraska specific, but he was talking about, there's other costs of not having kids in schools. In particular, he mentioned high schools where they're seeing far greater suicide rates that are in excess of the coronavirus rates of death. In fact, he said that of the 218,000 tests so far, that there was, I think, 35 school-age kids that have died. And while any death is going to be a tragedy, when he's putting that in perspective, he said, if you look at those school-age death risks, it's about, 1 in a million. And that's, to put in context of the regular influenza, the regular influenza is over the last 5 years, the deaths have been 5 to 10 times greater than what we're experiencing coronavirus. And of course, we don't talk about keeping kids home from school because of influenza on a general basis. But though when we do have a school that has a wide outbreak of influenza, sometimes that school does close down. So it really gets back to the facts and circumstances of, your particular school. And again, back to what I can't remember if it was Kim or somebody else said, is you don't want to have a prescriptive scenario that you automatically go to, but look at the specific facts and circumstances of your school and then work with your public health department to make the best database decision that you can, understanding that the deaths could be higher if your kids are not in school from things like suicide. And Dr. Redfield also mentioned that drug overdose was in excess of their background, more so than, and it was a greater than the coronavirus deaths. So in those two particular cases with regard to suicides and drug overdose, what we're seeing is that the high school deaths are actually greater than coronavirus deaths. So you have to keep in mind the bigger picture with regard to what we're looking at and weigh all those risks. The fact that the regular flu is probably going to be 5 to 10 times more dangerous to school kids than coronavirus, and weigh that against all the benefits that kids are getting by being in the classrooms, where some kids are just not going to learn well in remote learning situations, but are going to do better in the classroom. And then all the other things we talked about with regard to physical health, mental health, socialization, nutrition, all that, those are things that schools provide. And then, of course, another one, child abuse. Some of the leading calls that we get into our child abuse hotline are coming from teachers. And since the pandemic, we've seen those drop off dramatically. Now, I don't believe that means that the amount of child abuse is dropping off. I think that means that child abuse has dropped off dramatically. So yet another reason why we want to have kids back in classrooms, so that teachers have the opportunity to be able to intervene if necessary. So there's a lot of reasons why it's important to have those kids back in classrooms. And I just want to reiterate and say I appreciate the things that our public health directors have said. As we've gone through this pandemic, we've worked together closely. We've tried to use data to make decisions. We've tried to use judgment and common sense to be able to do this and do it in a way that is reflective of what's going on in each individual public health department, understanding that what's happening in Omaha and Lincoln may look very different from what's happening in, the Banner Public Schools. So anyway, just really wanted to say thanks to everybody on the call for all your great work on working on these plans. I think the plans are very important. I've been encouraging parents to work with superintendents and principals and teachers because, again, we're all learning how to do this, on our own. And then finally, I'll just wrap up from the state's perspective. Again, we look at kind of our 6 pillars, and Jeremy mentioned some of this with regards to PPE, but making sure we've got appropriate PPE on hand. We are ramping up our testing. In fact, in Omaha, we will be adding another site at the Oakview Mall. And while we've got 1,600 test slots available at the Crossroads, we expect to get Oakview Mall to the same amount as well. We've got 500 slots a day in Lincoln. And then we're working with local public health directors and hospitals and pharmacies to be able to establish testing in different communities through Test Nebraska. And so that's going to be one of the things we use to be able to do the testing. We also are ramping up our contact tracing. Local public health departments have about 218 people that are assigned to contact tracing, and we at the state are working to add another 1,000 on top of that to be able to supplement their work and be a force multiplier for them, so that if there is a case in one of your schools, that we can quickly get on top of it with regard to contact tracing to be able to determine who's out there. That's going to be important. We're working on our plans for at-risk communities like our long-term care facilities. We've got our directed health measures in place. So all these things are the pillars that we're working on and to create more capacity to be able to handle what is coming up with regard to the new school year. And then finally, just again, continuing to educate people around the social distancing rules of keeping 6 feet apart, wearing a mask when you go to the store, washing your hands often, avoid a crowded bar or restaurant. I mean, these are things that I think you all again can help communicate out to your communities to be able to help remind people about this. You can't say it too often to remind people about what's going on. And it also will make a difference when you do have that case of coronavirus. As we had in a case in Omaha where a girls basketball team was doing conditioning, and one of the girls came down with it, but they were all practicing good social distancing. I think they were doing their workouts 15 feet apart. And the public health director made the determination nobody needed to quarantine because they were following those social guidelines. So those can make a big difference with regard to the decision on whether to quarantine people or not, how actively people are using those social distancing tools that we have to mitigate the virus. So anyway, with that, I just want to again say thanks to everybody for all your great work, and we're going to continue to be here to support you as we get these schools open. And we will have to be flexible and ask patience of our parents because this is something new. Nobody's dealt with the pandemic here in over a century, and every school is going to be a little bit different. And we want to make sure that we're doing all we can to make sure kids can safely return to schools, and that we can keep progressing on the education and all the other important things that schools provide. So thanks, folks.
Thank you, Governor. Appreciate that update and reiterating some of your key messages from this morning's press conference. One of our key partners in all of this has been our educational service units, who have been serving both the public and non-public schools within their regions. And I would love to hear just a quick update from Craig Peterson, who coordinates the ESU Marketplace and some of that cooperative purchasing, to give us just a quick update. Craig, thank you first for all of your work, and then would love to hear just any quick updates from you.
Thanks, Lane. As all of you know, the state purchasing has requested 2.2 million masks. On July 7th, that order was placed. As of this morning, 1.1 million arrived, and we have 3 SUs total that have picked up since this morning. So we're expecting an additional 1.1 million to arrive sometime this week. And we're pretty optimistic that by August 12th, we will be able to have all those masks in. So we just encourage you to work with your local administrator, both public and private, your local ESU administrator on distribution of those masks. Those will be distributed through the ESUs. So stay in close touch with them. Additionally, I would say that those are all adult masks. So we've been through the ESU Marketplace and our vendor partners able to source a number of youth masks. And so if you have a need for that, let us know. That's those grades 3 and below. And so if those adult masks do not work for those smaller children. So likewise, we're able to source some disposable youth masks also through some vendor partners of ours. So if you're needing, to locate other PPE items, for the most part, we've been able to locate those for school districts on a per request. Just shoot us an email at coop@esucc.org, and we'll see how we can source that and what vendor partners may have those items. So that's really the update on the masks, though.
Yeah, thank you, Craig. I appreciate all of your work. And again, just email that coop@esucc.org, or you can reach out to Craig or specifically to your ESU administrators in your region. We do want to provide, just in this last 12 minutes, some quick updates. And I'm going first, actually. Our Launch Nebraska website has undergone a little bit of construction over the past couple of days, where we've been archiving some things and bringing to the forefront really just the specific documents that we think are most relevant during this time. So a couple of new additions, we're going to speak about a couple of them, but a couple of new additions here: the early childhood guidance for our earliest and our littlest learners, some considerations that follow along with the Launch Nebraska pillars. You'll also see some really helpful reentry scenario planning. I know that we're already there, but I offer that just as some additional guidance to help push your thinking. And then specifically the two on the left, the student attendance, and our Deputy Commissioner Brian Halstead is going to speak about that one, as well as the one right below that around human capital. I did want to let you know that there are really specific considerations around career and technical education and fine arts. So the types of equipment, the spacing, et cetera, require different processes, different cleaning, et cetera. So we have those in the hopper. They're being formatted as we speak, and we anticipate that those should be able to be sent. They've undergone quite a review from DHHS, from our local public health, as well as from practitioners in the field, our educators, our teachers that have really put a lot of good and helpful thought into those. So stand by. I know that those are coming down right to the wire, but they really fit nicely with our planning a safe return to school. So I'm going to turn it over now. If we can go to the next slide, going to turn it over to our Deputy Commissioner, Brian Halstead, our walking education encyclopedia. Brian, we're glad that you could join us. And if you could just speak just a little bit about our two documents, the student attendance document and the human capital document. Would love to just hear your thoughts on some flexibilities that schools can take part of.
Well, thank you very much, Lane, and good afternoon to everyone. I think this school year will present us the opportunity to maybe think differently about how we go about addressing attendance and how it is we go about ensuring students are connected to some form of learning, whether that is because they can be in school or when those situations where the student can't be physically present in a school, but the ways in which you can assist them by learning and count them in attendance. So in that regard, a number of the items we placed in the document are trying to assist you. First of all, think about how do you build a relationship with the families, with the parents. We already know that there are many who are concerned about the COVID virus. They're afraid to be in public settings, or they're afraid to send their children to school. So you may have to do some work on building relationships with those families. Many of the school districts have already created options for parents to allow their children to learn in a remote setting. We all know that's not the best, but at the same time, thinking through how it is you can keep kids and the families engaged in learning are going to be important and key for many of you. I know there are lots of people who say, well, how can we deal with attendance? And I think that's where we may have to rethink. The statutes and the regulations of the department provide a great deal of flexibility to local school boards on how they go about handling attendance and recording attendance. The language in Rule 2 lists off a number of school-sponsored educational activities where if students are involved in a school-sponsored educational activity, you can record them as being in attendance and present while they're doing work in a remote environment. So I think some of that is us having to rethink making a connection with the kids, making a connection with the family, working on building relationships better in some circumstances, and also about making sure that families understand what you're doing. They understand you're doing everything you can to ensure their child is safe, that your staff is assured you're doing everything to keep them safe and taking the steps to mitigate the risks that are involved with this school year and the COVID-19 virus. So I'll stop there, Lane, and see if you have any questions or others have questions.
Yeah, just quickly, Brian. So one of the biggest questions that we've been getting is, does attendance count if a student is in remote learning? Can you just answer that, or how would you approach that if you were a district leader?
Yes, a student whose remote learning can be counted in attendance and can be marked as present if they are in fact doing remote learning. And that's the simple answer to it. Many school districts already have policies and have the procedures in place for how they do that. The other fear I know that is out there sometimes misplaced, funding to school districts in Nebraska is not based on attendance. It's based on enrollment, membership, and the average daily membership or enrollment in your school districts. It is important, though, that kids are connecting And it helps if they're connecting every day and in every class to all of the instruction that's going on. But it is possible for a student in a remote learning environment to be in attendance at school today.
Thank you, Brian. Yeah, excellent. And I did put these two documents that were released, I think about a week and a half ago at this point, into the chat. And once you've kind of had a chance to digest, please, if there are any questions, reach out. You can reach out to Brian, reach out to me, et cetera, and we'll be glad to answer those questions. Let's move. We're almost out of time, but we do have plenty of time to hear about a really important topic, which is our PEBT update from Sharon Davis. Sharon, thanks for joining us.
Thanks, Lane. Wanted to express my gratitude to all the schools that worked so hard to get the information out to eligible families regarding the pandemic EBT benefits. The last push, the last weekend, we had over 30,000 families apply. So it brought us to a total number of 81,480 students that received the pandemic EBT benefits. Regretfully, we do have about a little over 1,600 students that so far we have not been able to verify their free lunch or free reduced eligibility for lunch. And so we are sending some of those requests out to schools to help us verify. So would appreciate if you do get an email that you look at those and respond quickly as possible. Also, I put into the chat box, we're getting a lot of calls about the application, the status of their application, and why they haven't received their PEBT cards yet. And so I'd like you to just direct those families, please, to DHHS, because Department of Ed doesn't have access to that application or that information. So just check the chat box out for that information. And thanks again for all your efforts. We really appreciate it. I thought very successful in getting these families the benefits they need. Thank you.
Thank you, Sharon, so much for joining us. And we are at our time, and we just are so thankful for all of the work that you've been doing. It's a really difficult time, difficult situation, but we are here for you. We are with you, and let us know how we can help. So thinking about those 3 pillars of Launch Nebraska, the continuity of learning, conditions for learning, and then leadership and planning, please let us know how we can assist with any of those parts. If you have questions about regulations or about content, professional learning, reach out to the department. If you have questions specifically around the health and well-being or considerations around some of your planning, please reach out to your local public health departments. And we heard front and center today how just valuable they are to this conversation and leading this work. So we're really thankful to you all for joining us today. Again, the commissioner sends his regards, and we will be back with you in a couple of weeks. So with that, just wanted to say thank you very much for being with us today and joining, and let us know how we can continue to serve you all. Thank you very much.